And now 15 more people have succumbed to COVID-19, raising the number of fatalities resulting from the virus complications to 438. The latest statistic clearly a worrying to government, even as it emerged that majority of COVID-19 cases in hospitals based in Nairobi are referrals from counties. In the last 24 hours, 497 more positive cases were recorded, pushing the total caseload to 27,425. Nancy Okware has the report.
There is no doubt that the coronavirus situation in the country is depressing as the figures get grimmer by the day. All the 47 counties already afflicted by the invisible enemy. On Tuesday, Health Chief Administrative Secretary Dr. Mercy Mwangangi announced 15 more fatalities resulting from COVID-19, out of which 11 had pre-existing medical conditions.
These conditions continue to be those that we've spoken about in the past. I think we have a large proportion of them today being diabetic hypertensives. And then we also have others who have other conditions, such as kidney failure.
The total of fatalities now stands at 438, with the ministry saying that it was now looking into ways of safely involving families of the deceased in funerals in a bid to stem the stigma associated with the contagion.
We have our case management team reviewing this to see how family members can further participate in that burial practice and perhaps be the pallbearers as opposed to the medical, clinicians, which can be intimidating and which can bring issues when it comes to closure. And so we are working on that, and I must emphasize this is not a final position, but we are reviewing how we would be able to then roll that out.
Within a period of 24 hours, 497 positive cases were confirmed out of 4,171 samples tested, pushing the COVID-19 burden to 27,425 cases.
We can therefore firmly confirm that the virus is in the entire country without exception. And this is not good news. However, there is hope if we stay focused and all of us play our part in fighting this pandemic.
Nairobi County, which has been the epicenter of the disease, had 236 cases, followed by Kiambu, which had 45 cases, Kajiado 26, Machakos and Mombasa 19 each, while Kisumu had 17 cases.
Is that 99% of the current bed occupancy in Nairobi County is attributed to facilities or is attributed to beds outside of the NMS service facilities. And what this means is that really we need to step up in terms of our preparedness. We have good reports coming in from counties, but it becomes important to note that many of the cases that we are handling within Nairobi County are actually from referrals from outside Nairobi County.
And with reports of a possible vaccine from Russia flooding social media for the better part of the day, the Ministry of Health says that it is looking into the reports with the aim of understanding if it really works.
We, through the Ministry of Foreign Affairs, shall engage to find out, what exactly, what vaccine has been deployed. Is it working? Back here at home, we are very proud of our scientists. Yes, Kenya is participating. We're in the second phase, and we have teams that are working, and we'll continue to appraise you in terms of our progress back here at home. And also, if it should be necessary for us to then plug into the Russian vaccine, that will happen in the laid down protocols and regulations of us being able to access that vaccine.
Meanwhile, 372 people have recovered, out of which 315 were under the home care program and 57 from the various health facilities. The total number of recoveries now stands at 13,867. With all the 47 counties having recorded coronavirus cases, the Ministry of Health is appealing to all the counties not only to invest in expanding the isolation bed capacity, but also in sensitizing the locals on the disease in a bid to end the stigmatization associated with it. Nancy Okware, Channel 1 News.